Hi, I'm Sarah from the Baby Wearing Academy, and I'm here to talk to you today about using your Nomad Carrier from Bizzi Growin in the back carrying position. Now, I will say I don't think that this is going to be suitable for everybody. I think that if your baby is below 6 months or is unable to sit unaided, then this is not going to be a good carrying position for them in this carrier. I also think that if the carrier doesn't fit you absolutely perfectly in the back carrying position, it's not going to be a good carrying position for you. I think there are other carriers that are much more suited to back carrying. So if in doubt, do see either your local baby wearing consultant or pop along to a sling library to find out if there's a carrier that works better for you. Please don't skip the safety information in this video, because I'm going to show you how to tell whether or not this carrier works well for you in a back carry. So yeah, please do not skip that. If you are new to back carrying, you're going to want to do this either over a soft surface like a sofa or near your bed, or have a trusted adult with you. You want them to stand just inside your personal space bubble, but not to touch you. You don't need them to help, because you need to be able to learn to do this on your own. A lot of the time, if you're doing this method, it's because you are on your own and you need to get the baby up and down on your own. But having somebody standing just inside your personal space bubble means that if you suddenly don't feel like you're necessarily feeling as secure as you could do, you can just say, take the baby, and they can just put a hand on the baby just to kind of hold them against your body, and then they're not going to fall anywhere. So either over a soft surface or with a trusted adult just within your personal space bubble. To set your carrier up for the back carrying position, if you've been using this in a front carrying position, what you've got is long undone shoulder straps. So what we're going to do is we're going to take one of those shoulder straps, find the buckle on the same side of the carrier, bring that round, buckle it in there, so that you've got a rucksack style loop. And then I'm going to do exactly the same on the other side. So buckle, strap, clipped in. Yeah, I've done that so that the adjustment is on the outside of the carrier, because what you don't want is if it's twisted like that, when you're trying to tighten that once you've got it on, it's going to be terribly difficult. So make sure it's the right way round. Just to clarify, you know it's the right way round because this is the outside of the carrier, this is the outside of the buckle, and here is the strap that you can tighten. It's going to be easily accessible there on the outside. Right, oh no, that needs to be done up, Sarah. Right, I'm now going to take that waistband, I'm going to flip it in towards me, and I'm going to put it relatively high on my body. You may be used to wearing your carrier around your hips in a front carry because your baby is bigger now, they're taller, and you like being able to see over them. But for a back carry, you're going to wear your waistband nice and high. You don't want your baby's head to be in the middle of your back. And in a front carry, your baby's head is here, and that's great, yeah? But you don't want your baby's head here, kind of like in the middle of your back in a back carry, because they're just staring at the middle of your back, they get bored, they can't see what's going on, they start to get fractious. So by wearing your waistband nice and high, what you're aiming to do is have your baby's head up here somewhere, kind of the upper back, or so they can see over your shoulders. It means they've got more or less the same viewpoint. There's stuff that you can talk about together. They've got a better field of vision, so they're going to just be that little bit happier with what's going on. I've also got my carrier a little bit looser than I intend it to end up, because I want to be able to move it around my body. I'm very right-handed. I take my babies around to my right-hand side onto my back. If you would prefer to go around to your left, that's absolutely fine. Whenever I talk about my right hand or my right side, think left hand and left side. Equally, if I'm talking about my left hand, think your right hand, and you should be fine on the other side. So if you're right-handed, follow me exactly. If you're left-handed, switch your lefts and rights and we'll be absolutely fine. Right, what I'm going to do, because I'm going around to my right, I'm going to take this body panel and I'm going to slide it round to my right hand side there. I'm then going to grab my baby. Oh, this is Sam, and I'm going to sit Sam on my hip there, around about the waistband. And I'm going to bring that waistband up over Sam's body, like so. I'm then going to get hold of a shoulder strap in one hand and the other hand, and I can bring those shoulder straps together in front of Sam, like that. That creates a bit of a seat belt. So that means I've now got Sam nice and securely. They're not going anywhere. If you're new to back carrying at this point, what you can do is play a bit of a game. Dropped you. They think babies are little adrenaline junkies. They quite like that sort of thing. And if they're either not sure about it, they don't necessarily react very favourably, then by all means stop. Don't back carry today. Do it. Try again another day. You know, practice that kind of feeling of, oh, look at you. Oh, where are you going? Sort of stuff. They'll get used to it. And then you can kind of take the next step as and when they're ready. So from here, I've got my shoulder straps, both of them in my left hand. If you're going the other way, it'll be your right hand, but I'm right-handed, so I'm using my left hand. I'm then going to take my right hand and it's going not through this strap. So I'm going to kind of bypass that strap and I'm coming through this strap and I'm going to bounce the baby round towards my back there. Once I've gone as far as my left arm will allow me to go, I'm going to use my right hand and I'm going to change hands. I'm still holding both of those shoulder straps, and the trick is to keep pulling the baby's weight in towards you. Yeah, so pulling the baby's weight in, I've got a hand on Sam's bottom and I'm going to continue to bounce round until I've got Sam as roughly into the middle of my back. I'm still holding tight to those straps, so I'm still not going anywhere. I'm now going to take my left hand, get my hair out of the way, and I'm going to find that other shoulder strap there. So I've got one in each hand. That's it. Look, you can see this shoulder's already in, and then all I need to do is get that arm into that shoulder strap. I've still got tension on those straps. So I'm still pulling Sam's weight in towards me. I can now hold that there, follow that strap round to the webbing. Is it twisted? And I can tighten that webbing. So Sam can choose to put their arm out through the same hole that my arm's through, or they can bring their hand out here over the top of the body panel. And at this age, honestly, they're going to do whichever they prefer. And that's absolutely fine. You want the shoulder strap to come up into their armpit, as long as the top of the body panel is at least in their armpit. So either up to their shoulders like it is for Sam, or if they've got their arms out over the top, it should be up in their armpit. Then you are absolutely perfectly safe. I think I have managed to twist this. Yeah, that's really annoying. Can I get it to tighten anyway? Yes, there you go. Okay, right. Oh, now I'm going to do exactly the same on this side. Follow it around. This one is not twisted, and I can tighten. Right, now can you see how high Sam is sitting on my body? I've actually just remembered I can now tighten my waistband. Now Sam is in the position that I want them in. So look how high Sam is sitting on my body. Yeah, it means that they can look over my shoulders, they can see what I can see. But when they've had enough of whatever is going on, Sam's got a really floppy neck, which is weird. They can just tuck into my body here and snooze. But yeah, now, this doesn't fit me particularly well in this position. I don't know, I can see it in me, I don't know if you can see it. I'm like that, you know. What happens is I've got those as tight as they can go, but I can still get hold of these and pull. And look at all that space. And what happens is that's actually as snug as I would like it. But these straps aren't going to go any tighter. When I let go of those, watch Sam. Did you see that? Sam kind of went, and the risk is that Sam will slump. And that's not great. I mean, at this age, they can take care of their own airways. So that's not really such an issue, but it's not going to be as comfortable. If Sam slumps away from me, over time, I'm gonna feel that. Ideally, I want them to be here, but these straps are too long. The padded section of these straps are too long for me, so I don't get a snug enough fit. There is also no chest band here. So lots of other carrier companies will have a chest clip which will hold these across your front. Now, again, the risk is that they'll slip off. If this carrier fits you perfectly, you won't have any extra space in those straps. They're then also going to sit better on your body, so you're going to feel less like you're at risk of them falling off. I feel like I have to do that a lot because that's going to keep, that's unsustainable. What you will find, some carrier companies sell strap separately. They're often called accessory straps. But yeah, they often sell them separately. To be fair, a bit of string, a ribbon, a shoelace, do the same sort of thing. What I'm going to do is pop that through that shoulder strap, bring it round, put it through that shoulder strap. Oh. And do it up in front of me there. Now that, can you see how that's pulled those shoulder straps in on my chest? That's taken away the room that I had here. So I can't pull up now, and Sam's not slumping away from me. So that is much safer. It's going to be much more comfortable in the long run. But yeah, like I say, this carrier doesn't have a chest strap. This is additional. I've done this myself. And it doesn't fit me. And I am not petite. I mean, I'm a size 14 on top. So, you know, yeah. I don't think it's for everybody. I don't think, you know, it's not a default option. But if you are, you've got more body padding than me, you might find it fits you. But make sure that you haven't got that extra slack in the straps. And if needs be, add an additional strap here. When it comes time to take the baby down, I'm basically going to reverse the process. So because I've added an extra strap, that comes off first. And then again, I'm bringing the baby round to my right. So I want to get my left arm out. I'm going to hold that left strap across my body with my right hand. I can then find the buckle, and I've just put my thumb on the buckle and push it away from my body. And that allows me just to get a little bit of slack in that shoulder strap. And I just want enough slack to be able to take my left arm out and down. So I'm still holding the strap in my right hand across my body. I can then take that over my head. And again, just like getting up, it's all about keeping Sam's weight pulled in towards my body. I can pick up the right hand shoulder strap on my way past. I've now got both those shoulder straps, and I'm still pulling Sam's weight into my body. If I need to very slightly loosen my waistband, I can, and then just start to bounce Sam round. The bounce takes the baby's weight off the carrier and makes it easier to move. I can then get my left arm onto the baby, slide my right arm out, and lift Sam clear. Got yourself caught up there, haven't you? There you go. So I hope that helps. You will get hot and sweaty when you practice back carrying. I don't know if you remember when you first started practicing front carrying, you got hot and sweaty. You will get hot and sweaty, and it's just about learning a new skill. Once you know what you're doing, it gets a lot easier. You can do it very quickly. If you've got an adult with you, the quickest and easiest way to do a back carrier is put the carrier on, again, high on your body, and get an adult to add the baby, put the carrier on and give you the shoulder straps. Equally, for taking down, if you've got an adult with you, you can just say, can you take the baby? And then you can slip your arms out. But this video shows you how to get it done on your own. Please don't skip the safety stuff. Go back, double check that you are being safe in your carrier, because it's also, as well as safety, it's going to affect your comfort. I hope that helps. And if you need an alternative carrier for back carrying, then do please find your local baby wearing consultant or Sling Library. In the UK, you can find them at slingpages.co.uk. I hope that helps, and I'll see you soon. Thanks a lot. Bye.